Hey guys, so in one of my recent videos, I did talk to you guys about the fact that I will soon be starting my new job in the sleep center, and I am starting the process of studying for the CPSGT. I kind of explained that in that video. If you guys don't know what that is a certified polysomnographic technician or technologist. I can't remember if it's a technician or technologist. But I had talked to you guys about the fact that I went and spent $80 on flashcards, and the set of flashcards that I got covered CPSGT and RPSGT, which RPSGT is a permanent certification. I mean, it's not permanent, like you do still have to renew it, but it's one that you can keep permanently if you continue to renew it. CPSGT is something that you can only have for a max of 3 years. Because they expect you to get your RPSGT in that 3-year time period. So I just wanted to show you guys the flashcards that I bought. So there are way more than this. This is just for CPSGT. And I kind of wanted to explain to you guys kind of what the reason. I think I had mentioned that I'm not really happy with the fact that I spent $80 on these flashcards, and like I'm using Quizlet question banks way more than I'm using these flashcards, and I think that that's really sucky. So I want to show you why. So this is literally just one section. I have 2 other sections like behind the camera right now of flashcards. Like this is the main chunk of information. This is sleep study preparation and performance. You can kind of see this is from Mometrics. If you guys have ever used them before, I know they do flashcards for like a bunch of different tests, but this one is specific to CPSGT. So first of all, before I show you the flashcards themselves, this is how they came. So I have not opened, this is for the RPSGT, obviously. It comes like this. So like you have to go through and detach them all by yourself. So like all of these cards, plus the 2 sections for CPSGT that are behind the camera, I had to go through and separate one by one. And they did not just easily come apart either. They are perforated at least, but they didn't just easily come apart. And that's really frustrating to me. This is for RPSGT. I haven't taken it out yet because I'm going to focus on CPSGT first, if that makes sense. Because I need the CPSGT within 3 months of being eligible. I need to have that. So I figured I would start studying before I even start work, before I even go through the A steps. So I have those. But another reason why I don't like them, and I've been using Quizlet more, is because, let me show you. So when I use flashcards, I like to have them in smaller chunks of information so that I'm not so overwhelmed. And so like this one. This flashcard says, discuss the pathophysiology of sleep in relation to arterial oxygen. So this is what frustrates me. Look at all the information that is on the back of this card. Like it's not in small chunks of information that I feel are usable. It's like, this is really overwhelming to even look at. And like all of these cards are like that. Like they are all huge chunks of information. Like there's a whole lot. Like even these, let me show you this. So this is discussing slow frequency artifacts. Look at this. So you have all this information on one card. Like it really overwhelmed me just to see it all. And all of these cards, like I said, are like that. And I feel like for what I paid for these cards, I'm really frustrated because at least on Quizlet, I can study smaller chunks of information that are more doable. I can't, like, even just to look at this, like this one, discuss the disorders and associated symptoms that may be discussed in the patient's history and physical. Do you know how many things can be in a patient's history and physical? Like sleep disorders, obstructive or central sleep apnea, narcolepsy, circadian rhythm disorders, restless leg syndrome, periodic leg movement, parasomnias, and insomnia. Then they go into like respiratory disorders, neuromuscular diseases, spinal cord injuries, gastrointestinal disorders, endocrine disorders. Like there's way too much information to be taken in on each of these cards. Like, there is way too much on one card. Like, even this, common abbreviations used for sleep technology. Why do you have like 20 of them on one card? And like, I get that there's a lot of information regardless, because sleep technology and sleep medicine, it's a lot of information and it's a lot to go over. Like, at some point I will show you the AASM manual for scoring sleep studies, because my new manager, I think it was maybe 3 days after I accepted the position, I asked him if there was anything that he recommended me studying, and he had me come up to the sleep center to pick up this manual that is a scoring manual, which is how we score sleep studies. And it is a lot of information. Like, I knew that I was getting into a field that included a lot, like, but that is a lot of information, and it's overwhelming for somebody that, like, I love to learn, and so I feel like I'm going to be fine, but it's a lot. And like, all of these cards, it's very overwhelming to me, like, just to see these cards with all of the information on them. And so, like I said, I've definitely been studying Quizlet more, because I feel like, at least on Quizlet, stuff is broken down into more doable chunks. Like, it's just frustrating. So anyways, if you are in sleep study, or you work in sleep studies, or you're a sleep tech, or you work in sleep medicine, whatever the case may be, have you ever tried these, and did you feel like they were too much information on one card? I mean, I get it. They're like, even this is the biggest section, but even the smaller sections, like, they're still big. And there's another one that's about the same size as this one that is still behind the camera. Like, it's a lot. And even these ones, like, it's the same. It's like paragraphs of information. Like this one, discuss the elements of the technician summary documented after a sleep study. All of this. Discuss formulas related to sleep architecture. All of this. Discuss third-degree atrioventricular block, which is something I already know about, just because I've taken ACLS. But this is a lot. Like, second-degree AV block, type 2 Mobitz. They have all of these. Like, it's discussing VTAC, junctional rhythms, PVCs. It's a lot. And like I said, I have these separated so that I can study one section at a time. But even this is like, this is too much. Like, I can't. It is just very overwhelming, to the point where I have not picked up these cards in over a week, because it makes my mind go crazy. But anyways, have you guys used Quizlet? Do you prefer Quizlet? If you work in sleep medicine or in a sleep center, what did you do to study? If you have taken the CPSGT exam, what did you use to study? Because obviously I have the AASM scoring manual. It's not the most up-to-date one, because I haven't joined AASM as a member yet. I do plan to, just so that I can get a discount on those things, because it is expensive to get the new one, the new scoring manual, but I feel like I need to get it. So anyways, pray for me, because this is going to be a lot. But anyways, I just wanted to show you those flashcards, because it's a little frustrating. Would you find this overwhelming? Because I definitely do. Anyways, if you guys want any more information about my new job, or about sleep medicine, working in a sleep center, or any other topic that I normally talk about on my channel, please be sure to let me know. I'd be glad to get something filmed for you. And with that being said, I will talk to you guys next time.